Sorry about that. So what I was saying was white blood cells are proliferating a lot faster, and they're immature. They're not maturing, and the leukemia will attack it, and that's what causes the inability to fight infections and causes the leukemia to have a very hard cure. The types of leukemia, we have myeloid leukemia. This originates in the bone marrow. So treatment for this is going to be bone marrow transplants. And then we have lymphocytic or lymphoid leukemia, and this is the malignancy of the lymphatic cells found in the bone marrow and lymph nodes. So again, we can have a bone marrow transplant for this, or removal of lymph nodes as well. Let's see. If we have acute lymphocytic leukemia, this is the most common form that we may see in children. This usually starts very abruptly and progresses very rapidly. And so this is why children, you'll see when they have leukemia, they have a very short lifespan, because it just goes through their body so fast. Chronic forms of leukemia are more common in adults, so the lifespan may be a little longer, but it is still deadly. They produce cells that undergo some maturation and can function partially. And then children, of course, theirs cannot function. So with the chronic form of leukemia, it's going to progress a lot more slow. Treatment depends on the stage it's in. We want to try to eliminate the leukocytic cells or leukemic cells, which are infected with the leukemia. So we want to try to inhibit their growth, maintain remission if we do go in remission, and prevent complications. Side effects of chemotherapy are very bad. The ability of the patient to tolerate adverse medication effects determines the intensity of the chemotherapy. So the physician may have to start lower and work his or her way up to see how well the patient can tolerate it, because the side effects are pretty bad. Now let's go on to pancreatic cancer on page 70. This is the 14th most common cancer worldwide and the most deadly cancer worldwide. It's often diagnosed in the last stages, because usually it's asymptomatic until the patient starts having weight loss. They may have some jaundice, which is yellowing of the eyes and skin, diarrhea, weakness, abdominal pain. So to diagnose it, of course, we're going to do a biopsy, but we can also do an ultrasound to see if the pancreas is enlarged or anything like that, or we can do a CAT scan to look at the head and tail of the pancreas. And then we can see if it's involved in any surrounding tissues, which by the time you have symptoms, it usually has. Surgery offers the patients the only chance for a cure, but of course you have to be on a waiting list, and sometimes you may not make it to the waiting list. So we mainly have to treat the symptoms. We may do treatment of jaundice, gastric obstructions that may happen because of it. And then we may do some chemotherapy to try to prolong the life while you are on that waiting list to get a pancreas. Survival rate is very poor, and they usually die within 1 year of the diagnosis of pancreatic cancer. Alright, so now let's go on to melanoma. That picture was just kind of thrown in there at an incorrect time. Melanoma is a skin cancer, and it's malignant proliferation of pigment-producing cells, or melanocytes. And this is a very, very, very deadly form of skin cancer. So the risk factors for melanoma are going to be light and fair skin, sensitivity to sunlight, sunbathing, like prolonged exposure to industrial chemicals like tar, arsenic, radium, and then any kind of past history of skin cancer will definitely increase your chances of melanoma. These can occur anywhere on the skin, but in men it will usually appear on the back, and in women it usually appears on the legs. So we have to be very careful. And sometimes a mole that you've had all your life, you have to really watch those, because those will usually turn cancerous into melanoma, so we really have to watch those. Early detection of skin cancer is possible by having your skin examined once a year. They usually starts with a small mole, and then it will start changing colors. The margins will start getting off and not even, and so we just kind of have to look at the asymmetry and the border and the color and diameter of the lesion to determine if it's a melanoma. And of course, we can do usually what's called a skin punch biopsy, where it just comes in and takes out the middle portion of the skin cancer. Surgery, the treatment is surgery to remove it. We usually have to do radiation because it's usually metastasized to other organs in the body. And so sometimes by the time it's already, the melanoma has changed color, or the mole has changed color, and you realize it's a melanoma, it may have already spread. It's very, very fast spreading. So we go by A, B, C, D to detect melanoma. A is for asymmetry, B is for border, C is for color, and D is for diameter. That's what they look at. And then you have a slide in your PowerPoint where you can look at a video on the topic of skin cancer. Alright, going on to thyroid cancer and then kidney cancer, and then we'll talk very shortly about the rest of the chapter. Thyroid cancer, very rare, but it can happen. This is usually due to an iodine deficiency. You may have had a radioactive iodine exposure, or any kind of radiation exposure can cause thyroid cancer. The thyroid cancer does grow very slowly, and it's usually cured by complete removal of the thyroid gland. So chances of death are very, very low. It usually causes no symptoms. You may get what's called a goiter, and that can be a symptom of thyroid cancer. But some symptoms of it is a hoarseness, dyspepsia, which is painful digestion or painful eating, dysphagia, not being painful drinking and eating. You may have some shortness of breath. So again, the only way to diagnose this is with a biopsy. The most common kind, we're going to go on to kidney cancer now, the bottom of page 71. The most common kind of kidney cancer is renal carcinoma. And renal carcinoma is going to be more common in men than in women. Kidney cancer, just like bladder cancer, the most common people to have this is your cigarette smokers. Obesity can also be linked to this, especially in women. Leather tanners, meaning women and men, but mainly as women, we like to tan. We lay in a tanning bed all day, we sunbathe, and our skin gets leathery. Shoe workers, dry cleaning employees, and people that have been exposed to asbestos. Kidney cancer usually causes no symptoms in its early stages, but then as it advances, we can have the blood in the urine, we can have flank pain, which flank is right here on the sides. That's what your flank is. And we may even have a palpable kidney mass that you can feel, the kidneys, it would be in the back. You may have like a little bulge on each side of your spine back there. So things that we can do to detect kidney cancer, we can do a urine test to see if any of the like ketones or anything like that are kind of out of whack, and to see if there's blood in the urine, and that will kind of give us a clue. What we can do as well is an IVP. This is an intravenous pyelogram, and it's an x-ray where they do a dye and it goes through the kidneys to see how they filter, and it'll show you if there's any tumors or anything like that. Surgery is the most common treatment for kidney cancer, but of course you have to wait for a transplant. Usually family, if it's the same type of tissue and the same type of blood type, family can give a kidney. Sometimes it works and sometimes it doesn't. It just depends. Renal cell carcinoma, if you do have that type, that is very treatable. It responds to treatment very well. Alright, cancers of the nervous system. on page 72. The majority of these are come in adults, and they occur in the central nervous system. These cancers are very rare, but actually they're getting more and more common in children, and we think that maybe it's related to prolonged exposure to TV, or headphones, earbuds in the ears, listening to music. That's just a educated guess. Nobody really knows. It has two peaks, one in childhood, like I just told you, and then older adults between 60 and 70. And then, of course, the brain is the most common place for metastasis for other cancers. Let's see. Sometimes in children, especially if they've had some other type of cancer and they're using radiation for treatment, sometimes the radiation can cause a brain tumor to develop, so that's a possibility. Signs and symptoms. Paresis, and I want you to look at that. That's one of your key terms. This is a slight paralysis. Speech. You may have some speech disturbances, some personality changes. And then of course you can have seizures as well. So there's a lot of symptoms with this. Large tumors can be life-threatening because it puts too much pressure and causes a massive brain damage with that. Headaches are very common in this because of the increased pressure in the cranium. To diagnose, we can do a CAT scan, we can do an EEG to diagnose as well. Of course, brain biopsy will provide a definitive diagnosis. And then what we do for treatment is surgically remove the tumor with either a craniotomy or laser surgery. Dexamethasone, this is a medication that we use for this, and it helps reduce the size of the tumor. Doesn't help it really go away, but it will reduce the size, and it reduces the swelling around the brain, which can help with the headaches and help with seizures and things of that nature. Let's see. And then pediatric cancers is the very last topic here. This is the second leading cause of death in children, is pediatric cancers. So these happen too frequently. Symptoms of early cancer in children are usually mistaken by things like the flu, ear infections, colds, tummy aches, things like that. So we include loss of energy, pallor, which is paleness, bruising easily, persistent pain, prolonged fever can be associated with it, frequent headaches, profuse vomiting, sudden changes in vision, sudden changes in weight loss. So you have to really pay attention, because if it's a prolonged tummy ache or prolonged cold symptoms, prolonged fatigue, it could be a pediatric cancer. So you need to make sure you keep an eye on that. Treatment for these are treated with surgery, combination of chemo and radiation, and unfortunately, the survival rate has improved. It was not good at all, and it's still kind of low, but it is improving day by day. Children may get secondary infections or secondary illnesses because of cancer treatment, and it's usually the side effects are just horrible for them. So if you look at table 4-5, you do not have to know the percentages of cancer, but this kind of talks about childhood cancer, the different types. I do want you to look over these and look over the disease descriptions, okay, because they will be on your test. Let's look into cancer and aging on page 74. As we age, everything, I think we talked about this in the very first chapter, but as we age, everything decreases and everything stops working as well, and that's why cancers become so prevalent in age. Cancer treatment for people that are 50 and above, or maybe a little bit older, are usually the same. Some patients may choose not to be as aggressive just because they are older. And then some patients do want the same aggressive treatment. It totally depends on the patient. So just to recap here, the screenings for cancer, or diagnosis of cancer, some of the screening recommendations are MRIs, endoscopies, ultrasound, biopsies, pap smears for your female cancers. So those are just a synopsis of that. And then the cancer staging, we have what's called the T&M system. And you can look at that. I'm trying to see where that is. I don't know where that is in your book, but it is in the PowerPoint, and you do need to know it. The T&M system is how they stage cancer. The T stands for the primary tumor. The N is the number of lymph nodes involved, if any. And then the M is any metastasis, where it has spread. And we have 4 stages, 1, 2, 3, and 4. 1 being the early stage, 4 being the last stage, and that usually ends in death. Let's see, cancer treatment, we have just trying to prevent cancer in general. Chemo prevention, we try to use other things besides chemo. Screenings, chemotherapy, radiation therapy, surgery. Those are all different types of things that we look at. And then table 4.6, this shows you the most common cancers and the screenings that are associated with it that you should follow, okay, because this can help you avoid cancers. Non-specific warning signs of cancer in box 4.1. Make sure you look over those really well. Let's see, I'm seeing if there's anything else we need to look at. And I think that's it. You can look over the diseases at a glance on 76 through 83. It gives you a good synopsis of all the diseases that we talked about in this chapter. Okay, so that's the end of chapter 4.